So today, I'll be discussing female infertility. Remember that in my previous video, I talked about male infertility tests. So today, I'll be shifting my spotlight to female infertility because infertility is not a man's issue alone. It is a couple's problem. And more importantly, a medical issue. And like I said, every medical issue has got a cause, and with proper evaluation, the solution can be found, right? So infertility can affect anybody. It can affect a man, it can affect a woman, it can affect even a virgin. It can happen to a virgin, right? And even those that have given birth before and suddenly finds it difficult to achieve pregnancy again. So in this case, we are referring to secondary infertility. So it's actually a medical issue, and we need to take a systems approach in dealing with every medical issue. So now it has happened. So let's assume from our previous video that the man, your husband, has been cleared, like medically cleared, capable of putting a woman in a family way. Yet, infertility persists. And maybe you entered the marriage as undefiled, as a virgin, and then you have been trying consistently to achieve pregnancy with a man that has been certified, medically cleared to be fit to give a woman or put a woman in a family way. Yet there is no pregnancy. So what do we do? What we do is to go to the hospital. We don't go to the village square to start discussing issue or go to families and all that. It's to go to the hospital to find out the problem. So let's walk into the hospital. So let's assume you get to the hospital, right? You get to the hospital. Of course, the doctor would take will do some investigation. Like the preliminary investigation is to check for your medical and reproductive history, and then do some basic tests. Maybe your thyroid will be checked, your weight, your BMI will be checked, and then a basic pelvic scan will be carried out. So from his preliminary assessment, he will know exactly what, or he may suspect what may be wrong with your condition, with you unable to conceive. It may be an infection, it may be a hormonal imbalance or hormonal dysfunction, it may be challenges with your ovary, your uterus, your developing follicles, or even your endometrium. It can be, a cytological problem, it can be a hematological problem, it can be anything. So from there, the doctor will request you to do a specific test, right? So let's walk into it. So today we discuss female infertility test, right? Female infertility test. So let's assume the doctor is suspecting hormonal imbalance, right? If the doctor suspects hormonal imbalance, some hormonal tests may be requested for you, right? Hormonal tests. Notably, the doctor will request you to do follicle stimulating hormones. Will request you to do luteinizing hormones. Remember that hormones are central to your ovulation, your menstruation, and pregnancy. Hormones actually communicate across organs, so they are essential, very important, central to your ovulation, your menstruation, and pregnancy. So if there is an imbalance in your hormone, ostensibly there is no way you can get pregnant. So the doctor may request you to do follicle stimulating hormones, luteinizing hormones, your progesterone, you may do your prolactin, you may do your anti-Mullerian hormones, and a whole lot of that, right? But it is important to note that your follicle stimulating hormones and your luteinizing hormones, they are done 2 to 4 days of your period, of your menstrual cycle. Right? So it means, assume you start your menses today. So the sample can be taken on the 2nd day to the 4th day. You can either take it on the 2nd day, 3rd day, or 4th day. We do this because pre-analytical measure analytical measure and post-analytical measures, they are important in you having a good result, right? So these are the days you can take the sample for follicle stimulating hormone, luteinizing hormone, even your anti-Mullerian hormones too can be taken within this day, right? This anti-Mullerian hormone will check the the number of ovaries, the number of eggs you still have in your ovaries, right? So progesterone and prolactin can equally be checked. Now, progesterone is taking, the sample is taking 7 days to your next menses. Progesterone sample is taking 7 days to your next menses. So let's assume you have a 28 day cycle, right? 28 day cycle. So progesterone sample can be taken on day 21. That is 7 days before your next menses, right? So prolactin too can be investigated. Prolactin can be taken at any time of the day, any time of the month. Do you understand me? But it is important to take prolactin 3 hours after waking up in the morning. So if you are able to follow this pre-analytical, analytical measure, you'll be able to get, the right result, right? So these are some of the hormonal tests your doctor may request you to do to actually ascertain the cause of your infertility, right? Now, your doctor may suspect an infection, right? Your doctor may actually suspect an infection to be the cause of your infertility, right? So infection essentially, they are caused by microorganisms, right? So we'll go into the microbiology unit. Here, we go into microbiology, right? So here, your doctor may request you to do high vagina swab, endocervical swab. Do you understand? Your bacterial vaginosis, your doctor may request you to check for candida, and then your trick. Do you get? So all these tests will be done to check whether your system or your condition is central to an infection. Remember, infection can block your tube, can cause damage to your reproductive organs. So when you have chronic untreated infection, it may equally, block your chances of becoming pregnant. So the doctor may check whether you have, any bacterial or fungal infection that may be, stopping you from getting pregnant, right? Apart from that, some imaging tests can equally be carried out. Like we want to check the overall, picture of your uterus. We check for your uterus, right? We check for your ovaries. We check for your developing follicle. We check for developing follicles. We check for endometrium thickness. This can be done using your pelvic scan, right? To actually see the picture of your uterus essentially. Beyond this, your tubal potency or patency can be ascertained to check whether, your fallopian tube is open, right? So the result you can do a test called hysterosalpingogram. Hysterosalpingogram is just to check for your, tubal patency. The result may come out as patent, non-patent, impaired patent, whatever, is to check the freeness of your fallopian tubes, right? So those radiological tests can equally be carried out to check whether you have problem or not, or to check where, the cause of your infertility is coming from, right? Again, some hematological analysis can be done, right? Some hematological assay can be done, like your full blood count, can be done to check for, anemia or even infection. Your blood group, can be equally carried out. Do you understand? Then your rhesus factor, your rhesus can be checked. Do you get me? So when talking about female infertility, it is a lay down procedures we follow. Lay down procedures we follow. If you are able to do all of these tests, then about 95 to 100% of the causes of the infertility can be ascertained, can be accurately ascertained. So it is not a matter of saying you come into the marriage undefied. Your husband has been cleared, medically cleared to be fit to put you in a family way, yet there is no conception, there is no pregnancy. And now you want to transfer the blame to your village people. No, leave village people alone. Go through all of these tests. I am sure by the time you are done with all these tests, you will actually know where the cause of your problem is coming from. So again, let us assume that after going through all of these tests, you are certified free and fit to conceive, yet no pregnancy. That will form the basis of my next video, causes of infertility. And then I give you a practical measure or practical measures on how, to free yourself from this medical condition called infertility. Thank you.